Today we will be talking about chronic obstructive pulmonary disease, also known as COPD. We will be giving information about what COPD is, the signs and symptoms, risk factors, complications of COPD, and interventions to help COPD. Also included in this video are San Joaquin County resources available to COPD patients and anyone who is interested in learning about COPD. COPD, which stands for chronic obstructive pulmonary disease, is a preventable disease that obstructs the airways of our lungs. When noxious particles or gases such as cigarette smoking is introduced into our lungs, our body reacts to it through an inflammatory mechanism. If there is constant inflammation in the lungs, it causes thickening of the walls of our airways because of the constant ongoing injury and repair. Not only does it cause the airway to constrict, excessive mucus is produced to help protect the lining of the lungs. Because of the constriction and excessive mucus, it makes it extremely difficult for air to travel through the lungs. The two types of COPD is emphysema and chronic bronchitis. In emphysema, the air sacs of the lungs are enlarged and damaged. The air sacs lose their ability to inflate and deflate, preventing oxygen and carbon dioxide to exchange. In chronic bronchitis, the bronchioles are thick and swollen, which is accompanied by sputum production. This also limits the amount of air that is taken in.
Signs and symptoms. The three primary signs and symptoms of COPD are chronic cough, which is a cough that persists for a long period of time, sputum production, and dyspnea. This means difficulty or labored breathing. In mild cases, this happens during various physical activities, and as the disease progresses, dyspnea will happen during rest. Other symptoms include, but are not limited to, weight loss, use of accessory muscles, for example, using neck muscles while breathing, respiratory insufficiency, and respiratory infections. An advanced symptom is tripod breathing. This type of breathing is recognizable by these three signs. Patient is leaning forward, his hands on his knees, and while inspiring or breathing in, there is supraclavicular fossa retraction. This looks like indents in between the patient's clavicles and neck. It's important to note that these symptoms may worsen over time. However, displaying signs and symptoms does not mean you have COPD. Contact your healthcare provider if you have concerns.
The risk factors for COPD are both environmental and host risk factors. And the first leading risk factor or cause for COPD is cigarette smoking. It doesn't necessarily mean that you have to be a smoker, but you could also be a passive smoker. Smoking accounts for 80 to 90% of the COPD cases, so it's very important for the nurses to educate their patients on smoking cessation or also get a social consult where they can find help to stop smoking. Another risk factor is the deficiency of the alpha-1 antitrypsin, which is an enzyme that protects the parenchyma from injury. And usually patients that lack this enzyme, they are treated with alpha protease replacement therapy. And pretty much that's just they're born without the alpha-1 antitrypsin. And other risk factors could include age. It's not clear whether healthy aging is an independent risk or whether the risk is related to the exposure over time, maybe to environmental conditions. So it's just not a clear, or there've not been any studies to show yet. But age is still a risk factor, as well as lower socioeconomic status. That is, people with lower socioeconomic status, they have increased patterns of exposure, maybe indoor or outdoor pollutants, crowding, poor nutrition, infections, and increased smoking. So that's just another risk factor.
There are many complications of COPD, but we'll be focusing on three: cor pulmonale, acute exasperation, and acute respiratory failure. Cor pulmonale, or pulmonary hypertension, is caused by constriction of the pulmonary vessels as a result of alveolar hypoxia. Respiratory acidosis can further potentiate the vasoconstriction. Hypoxia causes erythropoiesis, and this can eventually lead to polycythemia. Polycythemia makes the blood much more viscous, adding to the already high pulmonary vascular resistance. 50% of cases of cor pulmonale in North America are due to COPD, and cor pulmonale is a late manifestation of COPD. Next is acute exasperation. According to the Global Initiative for Chronic Obstructive Lung Disease, a COPD exasperation is an event in the natural course of this disease characterized by a change in the patient's baseline dyspnea, cough, and or sputum that is beyond the normal day-to-day variations, is acute and onset, and may warrant a change in regular medication in a patient with underlying COPD. Acute exasperation is typical in the course of the disease, with increasing in frequency as the disease progresses. It is primarily caused by bacterial or viral infections or air pollution and environmental sources, and exasperations may be treated at home or in the hospital depending on the severity. And as severity of the COPD increases, exasperations are associated with worse outcomes. The last complication we'll be talking about is acute respiratory failure. This results from waiting too long to seek medical attention from a severe exasperation, and or abrupt discontinuation of medications can precipitate respiratory failure. Patients with COPD have exacerbations are at risk for developing respiratory failure, and the use of sedatives such as benzodiazepines or opiates may suppress the ventilatory drive of the patient with COPD.
Interventions to help COPD patients. The first intervention is minimizing environmental irritants such as dust and smoke. Primary causes of an acute exacerbation include tracheobronchial infection and air pollution. So ensuring that the patient's triggers are not in the environment, the patient to avoid these complications, as well as smoke cessation. Providing supplemental oxygen therapy. The main goal is to keep an arterial oxygen saturation of at least 90%. Pursed lip breathing, which is a breathing technique where one breathes in through the nose and breathes out through the mouth slowly, and on the expiration to breathe around 2 times as long as you would during your inspiration. The pursed lip breathing allows for trapped air in your lungs to be expelled, and it slows your breathing rate, and it relieves shortness of breath. Other interventions for COPD patients include physical exercise via treadmills, stationary bicycles, and measured level walks, which can improve symptoms and increase work capacity and exercise tolerance. The key is to rest as needed and start out slow. The last intervention for COPD patients are medications, which are bronchodilators, corticosteroids, and there are some other medications that I'll quickly name off. Bronchodilators relieve bronchospasms by improving expiratory flow through widening of the airways and promoting lung emptying with each breath. These medications alter smooth muscle tone and reduce airway obstruction by allowing increased oxygen distribution throughout the lungs and improving alveolar ventilation. Typically, these medications are administered via inhalants. They may also be combined with corticosteroids. Corticosteroids are not typically given for long-term treatment. They are usually a short trial course of oral corticosteroids, which may be prescribed for patients to determine whether pulmonary function improves and symptoms decrease. A couple other medications that are given are the alpha-1 antitrypsin augmentation therapy, which is for patients that do not have or do not produce the alpha-1 antitrypsin, which leads them to have a risk for COPD, even if they're not smokers or have triggering irritants. Antibodies and vaccines are also used for COPD COPD patients in order to avoid infection or treat infection, which infections are known to cause COPD exacerbations. And antuvisives are they suppress coughing. And vasodilators and narcotics are also given if the patient, so vasodilators will obviously dilate the vessels, and narcotics are for pain.
San Joaquin County has many resources for their COPD patients. The first one being San Joaquin County Asthma and COPD Coalition. This is located on 420 South Wilson Way, Stockton, California 95205. In this location, there's resources available to COPD patients and information about the disease. Another one is the California Thoracic Society. You can find their website at calthoracic.org. And on this website, there's resources to find physicians and healthcare providers in the state of California that specializes specifically for COPD. And another one is Live Stories. The website is livestories.com, and this is where you can find actual statistics of COPD that is happening in San Joaquin County.